So, hi everyone, my name is Raina. I'm a clinical pharmacist here at Sarasota Memorial Hospital.
And my name is Megan. I'm an infectious diseases and antimicrobial stewardship pharmacist here at SMH.
And today we're here to talk to you about the flu and hopefully provide you with some of the facts so you can stay well during this flu season.
So we're living in the age of information. There's a lot of information out there, whether it's magazine articles or social media posts or word-of-mouth stories about how to prevent the flu, how to treat the flu, and certainly a lot of information out there about the flu vaccine. So unfortunately, like the flu, which is a virus, misinformation about the flu can go viral too. And we know it can certainly be challenging to wade through all of the information that's out there and determine which are reliable sources. So the goal for our presentation today is to do all of that work for you so that you can get the facts and increase your chances of avoiding the flu this season.
Alright, so before we jump into the information, we'll touch briefly on the amazing defense that is your immune system.
I love analogies. So this is kind of my analogy of how your immune system works to protect you against pathogens like the flu. So you can think of your immune system, including your white blood cells, as a force of security officers that patrol a building, preventing unauthorized people from entering. Your body is like a secured building, so all of your own cells have tags on them that are like ID badges. So your immune system, as it patrols your body, it checks these ID badges to make sure that there are no invaders. So pathogens like bacteria or viruses like the flu also have tags. So when your immune system is patrolling your body, it'll check their identification, realize that they're not supposed to be there, and then mount a response to subdue them.
So at this point you may be thinking, well, how can I help my immune system guard against the flu?
In the first section of our presentation today, we'll touch on how to prevent the flu, and also a short section on how to treat the flu if you do get it. So in the wise words of Benjamin Franklin, an ounce of prevention is worth a pound of cure. So we'll focus on prevention in the first section today.
So we'll first talk a little bit about prevention, and one of the main things about prevention is self-care. So it's often a common word people use when they're talking about keeping themselves healthy, especially during the flu season. And there's nothing really new or innovative about some of these things. There are things that I think we all commonly know that's important for prevention. So we want to make sure that you're maintaining a healthy lifestyle, keeping a balanced diet, getting enough sleep every night, trying to reduce stress whenever you can, getting adequate sleep, and of course one of the most important things that we're going to be talking about is vaccination. And that's one of the major things that you can do for prevention.
So you may be thinking, why is vaccination so important? Receiving a vaccine is like giving your immune system a wanted poster showing it what the flu looks like. So to use our analogy, when your cells are patrolling your body, when you get the vaccine, you give them that wanted poster, and so they can more quickly recognize the flu and mount a response against it.
And so another way to prevent yourself from getting the flu is to decrease your chances of coming in contact with them. That's probably the number one thing you can possibly do. It's especially important to wash your hands with soap and water as much as you possibly can before and after eating meals, sharing any items with other people, anything like that, as well as using alcohol-based hand washes are really good for preventing the spread of the flu. The flu is very contagious, so it's important that if you are exposed or near someone that does have the flu, maybe using a mask to cover your face and trying to avoid contact as much as possible. It's also important to disinfect surfaces as regularly as possible. The virus can live on surfaces up to around 2 to 8 hours. So it's important that we clean as much as we possibly can so we can lessen the spread of the virus.
So if, despite your best efforts, you do become sick with the flu, please do your best to protect other people. It is recommended that you stay home for at least 24 hours from work or school, for at least 24 hours after your fever has gone away. So it is important to realize that this means you have been without a fever for 24 hours without the use of medications like Tylenol or ibuprofen. Another way you can help to prevent the spread of the flu and other viruses this flu season is to observe proper cough or sneeze etiquette. So trying to cough or sneeze into a tissue or into the crook of your arm if the tissue is unavailable. And to throw away used tissues right away. This helps prevent contaminating surfaces with our hands.
And you may have heard that there's some other natural remedies or more homeopathic options to help for the flu. So you may have heard of some of these things, and people often confuse them. So people often think that vitamin C and zinc will cure your flu, and that isn't necessarily true. It doesn't really suggest that it will prevent the viral infection, but vitamin C can reduce symptoms, and sometimes zinc can help reduce the length of a common cold. But there's less evidence for the use of zinc for the flu. Also, a lot of people have heard about using echinacea. There has been some benefit, but it may not apply to products that contain maybe a different species or a different quality of this herb. So be careful about trying to use medications like this. And then also elderberry. A few trials have shown that it can help maybe reduce flu symptoms. However, you want to be careful not to eat raw elderberries. They contain a toxin that is something you don't want to ingest. And definitely don't want to eat the leaves or stems. So if you do want to eat elderberry, make sure it needs to be cooked thoroughly so you can prevent any cyanide toxicity. And lastly, it's also important as a reminder that antibiotics are not helpful against the flu. This is a viral infection, not a bacterial infection. So antibiotics are not the best choice in this instance.
So there is a prescription antiviral medication called oseltamivir or brand name Tamiflu that is indicated to treat and in some cases to prevent the flu. It is most helpful if it started within 48 hours of the start of your flu symptoms, and if it started within that 48-hour window, it can help decrease the severity of your symptoms, possibly decrease the duration of your illness by about 1 to 2 days, and if you fall into one of these high-risk categories where you may be at risk of complications from the flu, Tamiflu or oseltamivir may be the difference between a relatively milder illness or hospitalization in some cases. The most common side effects with this medication are upset stomach and headache. It can be used in children as young as 3 years of age on up.
Okay, so what if you do get sick? How do you know it's the flu, or how do you know it's something else? Well, the flu is a contagious respiratory illness caused by the influenza virus, and it usually differs from cold and where it can range in severity and onset. The flu is very sudden compared to the common cold. It's different from what they call a stomach flu, and some of the common symptoms include fever, cough, runny nose, sometimes some fatigue or muscle aches, and some people can sometimes see nausea or vomiting with it, but it's very rare.
It is important to know when you should seek medical attention when you have the flu. Most people, or many people, will have a relatively mild illness. They won't require any antiviral medications or specific medical attention, and will typically get better in less than 2 weeks. But there are some individuals, and we'll talk about some of the chronic health conditions that put you at higher risk for more serious complications from the flu, which could include secondary pneumonia, bronchitis, sinus infections, or ear infections. And if you do have certain chronic disease states, having the flu can make those worse. For instance, if you have asthma, you may experience more asthma attacks while you have the flu. Or if you have congestive heart failure, you may experience an exacerbation or worsening of your heart failure while you have the flu. So it's always a good idea, if you fall into one of the categories that we're about to discuss, to reach out to your doctor and get further medical advice and kind of develop a care plan if you begin to experience flu symptoms.
And there are certain people that, as Megan talked about, that have a higher risk for developing flu-like complications or illness. So especially children who are less than 5, specifically those less than 2 years old, are at a higher risk, and also older adults greater than 65 years of age. Pregnant women also are especially important, as well as those that are residents of nursing homes or long-term care facilities. And then we'll discuss some more about people with certain medical conditions.
And these are some of the chronic health conditions that can put you at higher risk of experiencing complications from the flu. So again, if you fall into one of these groups, if you start to experience flu symptoms, it can be a good idea to reach out to your primary care physician to kind of develop a plan and make sure that you stay healthy.
Now, if you are an adult, There are some emergent warning signs that should trigger you to maybe seek emergent medical attention or go to an emergency department. So these would include difficulty breathing or shortness of breath, having some sort of chest pain or abdominal pain, sudden dizziness or confusion, as well as maybe persistent vomiting. And then specifically, if you do have flu-like symptoms that improve, but then they come back later and it's sometimes worse and it's accompanied by fevers and coughs, it might be best to go to an ER or an emergency room and see if you can maybe get help.
So for children, these are some of the warning signs that should kind of trigger you to seek more care for that child. Certainly bluish skin color can be an indication that maybe the child is having trouble breathing. Or if they're not drinking a lot of fluids, they can become dehydrated. If kind of similar to what we discussed with adults, if initially their symptoms get better, but then they come back with a vengeance, or maybe they start developing a fever with a rash, those can also be warning signs that you should seek further medical attention for that child.
So infants can be a little bit harder because they can't really verbalize how they're doing. So mostly we look at some certain signs that indicate that we may need further care. So with infants, we're looking at if they're unable to eat, if they're having trouble breathing, if they're crying without tears, or even if we notice that there's fewer significantly wet diapers than normal. These are all possible indicators that they're not as well as they should be.
So it will not come as a surprise to any of you that the flu is contagious. But however, what you might not know is that healthy adults are able to pass on the flu or infect others starting one day before symptoms even start, and then up to 5 to 7 days after becoming sick. And for children, that can extend out even past 7 days after they start experiencing symptoms. And typically, in general, symptoms only start 1 to 4 days after the virus actually enters your body. So the big takeaway point from this is that you may be able to pass on the flu to other people before you even know that you're sick. In fact, there are some people who can become infected with the flu virus and be asymptomatic, not have any symptoms. So this is why it's so important to kind of adhere to those common sense practices like good hand hygiene, trying to avoid contact with people you know are sick, and certainly staying home from work or school yourself if you do become ill during the flu season to try to prevent passing on the flu to others.
So we know for the most part, flu is spread person to person. It's a very contagious bug, or not bug, virus. And it can spread to others up to as much as 6 feet away. It's mostly spread by droplets, so those that if you cough around, sneeze around, or just talking around, it can easily be spread. And they end up landing in the mouths and noses of the people nearby, and it's often inhaled into the lungs, and that's one of the first ways of exposure to the flu. Sometimes you can get it, but not often, just by touching certain surfaces. Doorknobs, handles, computer keyboards, things of that nature that have flu virus on it. Touching it and then touching your own mouth or nose is something that can enhance the transmission. So you want to try to clean off surfaces like we talked about earlier with prevention. Ensure you always wash your hands or use alcohol-based hand sanitizer. Thank you. So that's one of the best ways to prevent the spread of that.
Alright, now that we've talked about the signs and symptoms of the flu and how to prevent the flu and prevent passing it on to other people, we'd like to focus on, in the second half of our presentation today, busting some common myths that you may have heard about the flu vaccine.
Alright, so let's talk a little bit about the flu season in general. So right now we're in October, so we're currently in flu season. It typically runs from September through March and usually peaks about early December through February. About 1/5 of the U.S. population does get the flu every year. And during this last flu season from 2017 to 2018, approximately 40,000 Americans died of the flu. And that's actually the most recorded in the past 40 years. So there hasn't been a number seen this high before. The flu vaccine is, from the last year, the flu vaccine was approximately 40% effective against circulating strains, which isn't bad. And then the average cost of hospitalizations and outpatient visits related to the flu is estimated to be over $10 billion.
So one myth that you might sometimes have heard is that it's no longer necessary to be vaccinated against various illnesses. And while we have certainly made a lot of strides and made a lot of progress in terms of decreasing the annual or yearly number of cases that we see of various infectious diseases, we still hear about outbreaks of things like whooping cough or the measles. And in many cases, these outbreaks occur in areas where there are gaps in vaccine coverage. And certainly the vaccination is very valuable. We know, as we've discussed, that influenza continues to be a serious yearly threat, and receiving the flu vaccine can decrease the chances that you will require treatment for the flu.
All right. So these are examples of some successful cases in decreasing the number of various illnesses out there. So as you can see, things like smallpox, diphtheria, polio, we've almost essentially eradicated. We've definitely eradicated smallpox. There are some cases of diphtheria, polio, things like that. But overall, vaccination has really decreased these numbers. So it's important that we do get vaccinations as they have been shown to be fairly effective.
These are some numbers kind of put in perspective of benefits of the flu vaccine during the 2016 to 2017 year. During that year, an estimated 5.3 million cases of the flu are estimated to have been prevented by the vaccine, which is approximately the amount of the Atlanta metropolitan population. In addition, 2.6 million doctor's visits are estimated to have been prevented by the flu vaccine that year, which is more than all of the children who go to every K through 12 school in Florida. And then finally, the number of hospitalizations that are estimated to have been prevented are 85,000, and that's more than all of the hospital beds in California and Oregon combined.
So you may be asking, well, why do I need to get the flu vaccine every year? Well, the body's immune response from the vaccine declines over time, and the flu virus is actually mutating and changing all the time, which makes the previous vaccines that have been developed ineffective. So every year, the formulation of the flu vaccine is reviewed and updated to keep up with the changing of the flu virus. So the vaccine may not be 100% effective, but we often say don't let perfect be the enemy of good, because there is some protection available there, and it is trying to cover as many possible strains as there are.
So another thing that you may commonly have heard referred to is that some people have had concerns that the development of autism spectrum disorder may be linked to the vaccines that children receive in childhood. But actually there's been no evidence that there's a link between receiving vaccines as a child and developing autism spectrum disorder. The original study that was published in 1998 that suggested that link between thimerosal-containing vaccines or vaccines containing a certain component that prevents contamination of the vaccine. The initial study that suggested that link had several significant issues. It included only 12 pre-selected children. There was no corresponding group to compare those children to, so there was no what we would refer to as a control group. It relied on people's memories for the timing of events, and ultimately the authors made some very vague conclusions that weren't really supported by the evidence. And ultimately that journal article was retracted by the journal that it had originally been published in, and the primary author ended up losing his medical license.
And actually, since 2003, there's still been no link found between autism and vaccinations. 9 CDC-funded studies have found that there's no link between thimerosal-containing vaccines and autism. And in between 1999 and 2001, they actually did remove thimerosal from the majority of the vaccines in most flu vaccines. And this was mostly done as a precautionary thing to reduce mercury exposure. And then they found that before these studies were conducted that they determined that thimerosal was not that harmful. So they also found that there's no link between the MMR vaccine and autism. And most of these studies included hundreds of thousands of children, and they had with and without exposure, and they really did not find any difference seen between the two.
This is probably one of the most common myths that you have heard regarding the flu vaccine, and that's that it is possible to actually get the flu from the vaccine itself. And this is actually not the case. So the flu vaccines that are administered as an injection contain either an activated or dead virus, or they contain just virus proteins, not a whole virus. There is a live influenza vaccine, which is the intranasal version, but that virus was designed to like really cold temperatures, so it's actually not able to cause infections in the warm environment of our body. So it's actually not possible to get the virus from the intranasal vaccine either. So you may ask, why are so many people convinced that they have gotten the flu from the vaccine itself? Some people, and you may have experienced this with previous vaccinations, may get kind of a sore arm and even some low-grade temperatures after receiving the vaccine. But if anything, that's a good sign that your immune system is working and is kind of gearing up to protect you against the flu. So if we're using our security guard analogy, with the vaccine, we've shown it the wanted poster, it's recognizing it, and it's kind of gearing up and making antibodies to protect you in case you're exposed. One really important point to realize, though, is that it may not be possible to get the flu from the vaccine, it is possible to get the flu in spite of the vaccine. And this is because it takes your body some time to fully respond to that vaccine and make enough antibodies to fully protect you. And that process can take up to about 2 weeks. So if you're exposed to the flu either right before you get the vaccine or kind of within that 2-week window, it is possible for you to get the flu before you're fully protected. A third possibility is that you may be exposed to a strain of the flu that's not included in the vaccine that year. Depending on the type of flu vaccine you get, the most common 3 or 4 strains that they anticipate will be circulating that season are included. But there are many, many different strains of the flu, and unfortunately it's not possible at this time to include every single one of them in a vaccine. So that's a possibility as well. It is important to realize, though, when you get a flu vaccine, even if you do end up getting the flu, there have been studies suggesting that receiving the flu vaccine can decrease the severity of the illness that you get. So that is an additional benefit of being vaccinated.
Another very common myth is that vaccines should not be administered to pregnant women, and that's absolutely not true. Pregnant women are actually more susceptible to the effects of the flu. It's important that pregnant women protect both themselves and their baby from the flu both during and after pregnancy. So it's important that they do get that flu vaccine, and it's safe to give at any time during pregnancy, so not just beginning or in certain trimesters. Last year, only about 50% of women actually got the flu vaccine that they needed, so we definitely could work on having better numbers here. And if you are pregnant, it's good to always check with your doctor, especially with any other medications you may be taking, and see about getting your flu shot.
Who should be vaccinated this flu season? The CDC recommends that everyone 6 months of age and older be vaccinated against the flu. So you may wonder, why is it that children younger than 6 months are not recommended to get the flu vaccine? It's not because it's not safe for them to receive. It's actually because their immune systems cannot at that young age mount an appropriate enough or strong enough response to protect them. So if we go back to our security guard analogy, it's like we show them the wanted poster of the flu, but their immune system forgets it too quickly for it to be very, very helpful for them. So that's why we don't really give it to those children less than 6 months of age. But you might wonder, is it possible for those young children to be protected from the flu? Like Raina discussed on the previous slide, studies have shown that if an expectant mother is vaccinated against the flu, the antibodies or the protection that her body develops can be passed on to the baby and protect the baby for several months after birth. So the best way to protect a young child from the flu is for the pregnant mother to be vaccinated. Going off that, even older children between 6 months and 8 years of age, because their immune systems are still developing, if it's their very first flu shot, we even give them 2 in a row. And that second one is kind of a reminder to their immune system saying, hey, this again is that wanted poster. You need to kind of ramp up production of the antibodies to protect them. So even in that 6 months to 8 years of age group, we even give them a second flu shot if it's their very first one, as a reminder to their immune systems. Just as another reminder, if you do fall into one of these high-risk groups, it's especially important and especially recommended that you be protected against the flu. And again, just a reminder, it's a good idea to reach out to your healthcare provider if you do start experiencing symptoms so that you can develop a plan of care.
And like Megan briefly mentioned, there are certain groups that should not be vaccinated. So like she was talking about earlier, those under 6 months of age, it's not a great idea. Like she said, the antibodies are forgotten. And then there's severe life-threatening allergies to the vaccine. So if you've had it before and had a severe reaction or a very severe egg allergy, there are different formulations of the flu vaccine out there that are better for you, and we'll discuss more about the different formulations a little bit later. Especially if you've had any kind of serious adverse reaction after receiving the flu vaccine. GBS is a common condition that some people have had in the past. So it's where basically your body is attacking itself in a way. And it goes with any kind of other immune compromising condition. Bone marrow transplant is very common. Those kind of people should not be vaccinated, and they should talk to their physician further.
So there are a lot of different flu vaccines out there that are available, lots of different formulations, and it can be kind of confusing to figure out, what are some of the differences that I should think about when requesting to get a flu vaccine. So the first thing to kind of think about is that you'll hear terms thrown out there like trivalent or quadrivalent. And the differences between this, if it's trivalent, that vaccine contains 3 of the most common strains that the experts have anticipated that will be circulating that flu season. So it'll have 2 of what they anticipate to be the most common flu A strains, as well as one of the flu B strains. Whereas if it's a quadrivalent vaccine, it'll contain 4 strains of the flu, 2 of the most common flu A strains and 2 of the flu B strains. So with the quadrivalent, you get an extra strain thrown in there. So like Rita was saying, if you've had a history of a severe egg allergy, and what they define that as is any allergic reaction to eggs that is worse than hives. So if you have eaten eggs and experienced shortness of breath or swelling of the face and the tongue, or any serious reaction like that, anaphylaxis, something that's required you to seek medical attention, in those cases, you actually can receive any of these flu vaccines. They've done studies to show that even in those cases of severe egg allergy, there's not really any difference in reactions, regardless of which one you use. They're derived or recombinant vaccines that are not made with egg protein at all. So if you don't want to get the vaccine in that more closely monitored setting, these can be a good option to ask your either your pharmacist about or whoever will be providing that vaccine to you. And finally, if you're not a big fan of needles, I know a lot of us aren't, there are a couple of options for you as well. You can either get the intranasal vaccine, or with either the trivalent or the quadrivalent vaccines that are standard dose. There is an option to get it via jet injector, where high-powered air just kind of pushes it into your skin, essentially. So there are options out there for the needle phobic among us as well. And then finally, there are 2 different versions of the flu vaccine that are specifically formulated for adults older than 65 years of age. Not unlike the young children whose immune systems kind of have difficulty mounting a good response to the flu. Adults older than 65 can kind of have similar issues. And so there are 2 different formulations, the high-dose trivalent, as well as this adjuvant formulation of the flu that are specifically formulated for older adults to try to stimulate your immune systems to produce even more antibodies and protect you more from the flu. Kind of the difference, the high dose contains even more of those flu tags, so it's just like a higher dose. So it's like showing your immune system even more of those wanted posters, versus if you do the adjuvant formulation, it's got extra stuff in the formulation to kind of stimulate your immune system in other ways.
So the CDC does not recommend any specific flu vaccine over the other, but those were all the different options that Megan stated that are available to you, both either at doctor's offices or at your local pharmacy. So you can always talk to your physician or your pharmacist about what options they do have available and which ones they could possibly get if you do have a night allergy, for example.
There are many different options for places to get your flu vaccine. There are 6 urgent care centers here in Sarasota and the surrounding areas that have flu vaccine available. If you just want to kind of quickly walk in and get those, you can certainly get it at your primary care physician's office. And at most pharmacies, you can get a flu vaccine as well, whether that's Publix or Walgreens or retail pharmacies or even independent pharmacies that you may have a relationship as well. They will often do flu vaccinations. The health department is certainly an option as well, and then some employers will provide flu vaccinations for their employees.
So there's definitely a bunch of different resources you could check out online. The CDC has a wealth of information regarding the flu shot, as well as other vaccinations on that site as well. There's the Immunization Action Coalition, and for parents with children, you can always check out the American Academy of Pediatrics. Johns Hopkins has some great resources. The World Health Organization's website also has some resources regarding flu shots and other vaccinations as well as the National Foundation for Infectious Diseases.
So this flu season, we hope that you will spread the word and not the flu. And at this time, we'd be glad to take any questions that you may have for us.
Well, y'all pretty thorough.
Thank you.
You really were. I mean,
You make a very good team.
Oh,
y'all were very thorough. If I had a question, I didn't have any more. I mean, I just knew there was 2.
yeah. You have a question, Amy?
I have a question. How about outside of the flu season? Like, is there ever a reason to get a shot, like in May or June? Are there some areas in the country that seem to have the flu season throughout the whole year, or?
So the question from one of our audience members here at HealthConnection was, is there ever any reason to receive the flu vaccine outside of the normal flu season, which is typically the winter months for more temperate climates like we have here? So there could potentially be some scenarios, more tropical areas can have cases of the flu more year-round. So if you're traveling to one of those areas, you can always certainly reach out to your care provider or certainly to
Travel vaccine clinics.
travel vaccine clinics and places like that to see is the place I'm going to experience some cases of the flu right now, and could that be a good idea? Another scenario that I can think of is if there is a particularly bad epidemic season of the flu that might extend further into the spring than we typically see. You may see recommendations from organizations like the CDC at that point, if you've not already been vaccinated, to still receive a vaccine in those very sort of epidemic or even pandemic situations. Yes, ma'am?
how far back do they use their formulation to make a flu vaccine? Because it's not what's going on now.
Right. Every year it is reviewed, and they go through it to see what are the most common strains out there circulating, and pick the most common 3 or 4 and add that to the formulation. Now, it's not 100% accurate. It's usually just their best guess in terms of trying to find out which ones that you could possibly be exposed to.
Yeah, kind of the difficulty with making that prediction is flu is really sneaky. Again, I love my analogies. So it's like the flu is always trying to make like different versions of like fake IDs to fool your body and to kind of get away from the flu vaccine. So that's why it's such a challenge, and it's why, at least for right now, it's not something we can do like we do with a lot of our other vaccines, that it's just maybe a one-time vaccine and you're protected for life, or something that you get occasional boosters. It's because the flu is so sneaky and so good at kind of changing its appearance and trying to evade our immune system and our vaccines.
I think I heard sometime this past week that the CDC, that the FDA had approved a new medication for flus.
Yes,
That's
I'm so happy. I'm so happy that you've heard this. It's very interesting. I think it's the first new antiviral for the flu, I think in 40 years or something like that, quite a long time. I think it was just yesterday that the FDA approved, either yesterday or the day before, earlier this week, the FDA did approve a new antiviral for the flu. The brand name is Zofluza. Zofluza, kind of sounds like a sneeze. And the generic name is Baloxavir. And we still don't have a lot of information since it's brand new, newly approved. They did study it against our other antiviral that we mentioned in the presentation, oseltamivir or Tamiflu, and they did show that it was comparable to our existing antiviral, and it would be just a one-time dose in theory, and then you wouldn't have to take any more. It wouldn't be a 5-day course. Like
So it would be like if you already have the flu, it's like
correct.
the Tamiflu.
Yes, there are some cases, if you have maybe family members who are infected with the flu, there are some limited scenarios where a prescriber may give you Tamiflu to try to prevent you from getting the flu if you have to be in close contact with someone else who's infected. So that could be a potential reason as well that you might receive it. But we do anticipate, at least at first, because it is a brand new, newly approved medication, that the price tag might be a little bit higher than our other currently available medications.
Any questions from Facebook?
I have a question, but
Okay.
but I don't know if I will be able to communicate it to you.
Okay.
Amy still back there?
Yeah, he's back there.
Amy, how do you say culebrilla in English? Because this is off this topic, but
Herpes.
herpes.
The shingles.
Shingles, okay. I know this is not the topic,
Yeah.
but there's something new with shingles that if you have had shingles vaccine already, now there's a shingles vaccine, new shingles vaccine that has that they give it in 2 sets or in a couple of weeks. So I just wanted to know how good is that, if you have had the shingles vaccine at our age, why do you need it again?
So the question is regarding a new formulation of the shingles vaccine that you can potentially get even if you got the other version in the past. So honestly, I'm doing more reading myself about a new version of the shingles vaccine. My understanding is that even if you've gotten the older version, getting this new version can provide additional protection for you, and that's kind of the reason that they recommend for certain people to get redosed with this new version. But that's certainly something that I could dig into a little bit more, and I'd be glad to shoot you an email with a little more in-depth answer about that.
I was at my doctor on Tuesday, and they recommended, because I had mine in 5 years ago, and she recommended, even though I don't have any major medical, but she said, due to the fact that this would make you even stronger, except if you take one, and I think 6 months later you take the second one. And then you get it done at the pharmacy, not in your doctor's office.
I think the idea is that it's less effective over time, so it's essentially like a booster in a sense.
Well, I figured I had chickenpox twice, so I better get this
There you
twice.
And shingles is certainly miserable to get, so any additional protection is certainly a benefit from that perspective.
So if I had the flu shot 2 weeks ago, can I get the Shingrix?
I believe
Or
so.
do
I'm
I have
not
to
aware.
wait?
I'm not aware of any.
I asked the same question, told me to wait 2 weeks.
To wait 2 weeks?
2 weeks before I got the shingles.
Okay.
That was a question I had.
Yeah, there are guidelines that they follow in terms of timing of certain vaccines, especially live versus inactivated, things like that, so.
But what scares me is that she has other problems, and you know, why mess around with something that
If it ain't broken, why,
if
why
it ain't
fix
broken,
it?
why break it? You know, but and this is my girlfriend for 53 years now, and I want to be with her, have her with me for at least 100, you know. And so I have to be very.
He's gathering the research.
Yeah, we have to do research. That's why we go here, and we learn from you guys, from others.
But you know, your doctor told you, I mean, you said that you
Well, I had
had
asked that-
another medical.
Right, because I had read it and I was curious, and I knew I had the chickenpox twice, and I've seen my dad get those shingle shots, so I know they look painful.
Yeah, my father had shingles and my sister had shingles when she was very young. So, you know,
I'm the
but
prevention
I do
stage.
have one medical problem
Mhm.
that my doctor wants me to get the shingles, the second shingles. So,
If your autoimmune system is weak, and I would get it
Yes.
just for that reason alone.
yeah, it is.
Because if nothing else, it's kind of like the flu. If you get the
Yep.
flu, you'll have less symptoms because you got the flu shot. And maybe
Right.
with the shingles, maybe it works in that same concept.
But her hemoglobin was very low. His zinc comes up. So I don't know if we should wait till it's higher.
Should you take her for more steak dinners?
All right, well, thank you guys so much.
Thank you so much for coming, we really appreciate it.
I really appreciate it.